to the clap.
All good.
All right. Good afternoon, everybody, and welcome to today's Institute on Aging training, Not Alone, How Older Adults Can Build Connection, presented by IOA and the California Department of Aging. We wish to thank CDA for not only supporting today's program, but also for supporting Friendship Line California, which is overseen by Institute on Aging. Friendship Line California is a free crisis intervention hotline and warm line for non-emergency emotional support calls. We're going to be repeating this information and more later in the program. And I've placed some of this information in the chat feature. The number of Friendship Line California is 1-888-670-1360. Today's program will last 90 minutes, including Q&A at the end, and our experts will offer an overview of the growing public health concerns of social isolation and loneliness. They're also going to provide solutions and suggestions for maintaining ongoing connection with others and their own well-being. If you have a question for either of our speakers today, please write it in the Q&A section, which you can find by hovering your mouse at the bottom of the screen and then clicking on the Q&A button. We'll have time during today's talk to answer some of your questions at the end of the presentations. I will collect those questions throughout and then pose them to our speakers at that time, or if there is a better time that presents itself. If you're interested in continuing education units, these will be available from IOA, and these are for registered nurses, LCSWs, MFTs, LEPs, LPCCs, attorneys, and licensed fiduciaries. It takes about 12 working days to get the CEs, so thank you for your patience. They'll be delivered digitally along with an evaluation. And if anyone has questions about this, please feel free to contact me, Catlin Morgan, Education Manager at IOA, at cmorgan@ioaging.org. Today's presenters will be sharing their screens and their perspectives, and I will monitor throughout, though I will unpin myself from view. And now let's get started. During this recent year, we've all seen and felt some of the effects of isolation, as most of us have felt the loss of our usual connections. But for many older and disabled Californians, even in the best of times, grappling with social isolation and loneliness is commonplace, pandemic or no. Today's presenters are longstanding experts in the areas of social isolation and loneliness, and I would briefly like to mention their backgrounds at this time. Dr. Carla Perissinotto, MD, MHS of UCSF, was appointed as the first Associate Chief for Geriatrics Clinical Programs at UCSF, overseeing and managing both inpatient and outpatient clinical programs. She's an Associate Professor in the Division of Geriatrics Department of Medicine and board certified in Internal Medicine, Geriatrics and Palliative Medicine. And she's dedicated to working in both community and academic settings. Witness her being here today. Thank you, Carla. She has a special interest in teaching primary care doctors how to more effectively recognize cognitive impairment in the outpatient primary care setting. She's been the recipient of the highly competitive HRSA Geriatric Academic Career Award, with which she developed curricula to teach a wide range of learners on the care of elderly patients in diverse settings. She's gained national and international recognition for her research on the effects of loneliness on the health of older adults, and is frequently invited to discuss her research and the clinical and policy implications of the health effects of loneliness. With her today is Dr. Patrick Arbor, EDD, founder of the Friendship Line, and director of the Center for Elderly Suicide Prevention and Grief-Related Services, both programs at Institute on Aging. Dr. Arbor conducts workshops and presents lectures both locally and nationally, and he's the author of numerous articles and book chapters on a variety of aging-related topics. He's also been a senior lecturer at Notre Dame de Namur University in Belmont, California, an occasional lecturer in the School of Social Welfare at the University of California, Berkeley, and an adjunct faculty member at the Wright Institute. Dr. Arbor is the recipient of several awards, including the 2013 Health and Aging Award presented by the American Society on Aging, a silver medalist for public service sponsored by the Jefferson Award Regional Committee, and the 2016 Norma Satin Community Service Innovation Award for his commitment to human rights and community living. And with that, I am now going to unpin myself from this, although I will be here, and I will turn this over to Carla. Thank you for being with us today.
Great, thank you so much. And I will take 1 second to get my screens up, my slides up, and there we go. It's so fantastic to be here. And I have to say that any day that I get to spend with Patrick, even if for a few minutes and virtually, I will take it. And it means my week is off to a good start. So Patrick, I'm so thrilled to see you as always.
Thank you so much.
And it's so great to be here. What we're going to be talking about, as Caitlin explained, is really understanding how do we build connection and what is some of the science behind that. I will add that this is a dense topic and this is really just an overview. There's so much more to learn, but hopefully this will entice you to learn more, deepen your learning and expand your knowledge today and share with others. So what we'll start with is really some basics in terms of definitions. What are we actually talking about? And the reason we do that is that often when we talk about loneliness and isolation, these terms get intermixed. And so I want to make sure we have a common understanding. We'll spend a little bit of time talking about the health effects of social disconnection and the science behind this. And then really as it pertains to the friendship line, and for some of you who may be familiar with other programs or doing your own work, is how can we actually assess programs that are aiming to address loneliness and isolation to see if they work. So starting with definition, so what are we actually talking about? So loneliness is one topic, social isolation is another. Another way to look at it all together is actually social disconnection. So how good are we, or how well are we able to connect with others? And that can be in different ways. When we talk about loneliness, this is actually about the subjective feeling of being isolated. It means that there's a discrepancy, there's a gap between the relationships we actually have and those that we wish we had. And it's often distressing to us. So that's different from purposefully being isolated or being alone where we choose to be in that state. Social isolation is really an objective measure of the number of relationships we have with other people. It can be, and it's not necessarily just the number of people in our family. It doesn't relate only to being alone. It's all of these together. Now, all of both loneliness and social isolation or overall social disconnection has emotional components, functional components, and structural components. And what that means, again, is, for example, the structural components really pertain to, for example, the lived environment, the physical environment, and the barriers or enablers to helping us connect with other people. So something to just think about here. So from these definitions, so then the issue becomes, how do we know what we're talking about? What is it? And how do we study this in a systemized way or understand it? So first, what I think about when I'm trying to understand either what's going on in my community with my patients or with a program I'm evaluating, the first question I'm trying to ask myself is, am I talking about isolation? Am I talking about loneliness, or is it both? For example, during the pandemic. So what we know about the pandemic is that we were all forced into physical distancing. People call it social distancing. I like to call it physical distancing because it doesn't necessarily mean that you have to be socially distanced to be physically distanced. But the reality is during the pandemic is that there was this isolation that was mandated. Some of that resulted in loneliness for some of us. For some of us, it resulted in both. So what does that mean? The next step is talking about which population are we talking about. Loneliness and isolation can affect different people. We certainly have suddenly seen an increase in younger adults, for example, in teenagers who are experiencing increased loneliness, potentially as a result of the pandemic. But actually, if we look further back, this has been going on much longer. There's some concern that this is actually related to social media use and technology use, or inappropriate use of technology, I would say, because I don't want to say that technology is terrible, because obviously we're all here today together because of technology. The next step is understanding the mechanism. So why someone may be isolated or loneliness has different roots. Everyone enters into the pathway of being lonely or isolated by different means. For some, it may be because they have lost a spouse. For others, it may be because they're in the middle of the pandemic. For myself, it is because I was pregnant during a pandemic, which is not exactly a time that was welcoming to forming connection. So whether I liked it or not, I suddenly became isolated because I had to, and I had doctor's orders to do so. And that resulted in some loneliness as well, because I didn't have my usual community to support me through a pregnancy. The next step is understanding intervention theories. And what I mean by this is that when we've identified someone or a population who may be experiencing loneliness and isolation, what do we do about it? Now, that means that what we do about it we have to have a reason to why we think that'll work. And I think Patrick is going to tell us a lot more about how he started the friendship line, why he started it. He had a theory about this and why we think it's working. And then the last thing from all this, how do we actually measure what we're doing and how do we implement these programs? And I think the friendship line is living proof of how this is done. So to identify social isolation and loneliness, there's a couple ways to think about it. First of all, for some people, so for myself, I was able to say, hey, I was actually lonely during the pandemic because of certain factors that changed for me during the pandemic. So that's me being able to say that. But there were also some screening tools or objective tools that we can use. Unfortunately, the current state of the science is that there's actually no gold standard screening tool, which means there's no one way to do this. All of the tools that exist have benefits and drawbacks. Very few have actually been used clinically. A lot of them have been used for research, but there's an opportunity now to see how these work in practice. So I've listed a whole bunch of these here. I think the most common ones to be aware of are, for example, the UCLA loneliness scale. The reason why this is used is because there's a short version, which is 3 questions. And then there's a couple other ones that are more related to social isolation and social connection. The Berkman-Syme is actually one that was recommended by the Institute of Medicine to be used in electronic medical records, just as a note. And then most recently in the last year, there's one called the USERS, which was developed by a colleague of ours in Texas. And the idea is that you answer some questions and you get essentially a red, yellow, or green light. In terms of green, you're doing great, you're connected, don't need to worry. Yellow, you got some stuff going on, you got to start worrying about your connection. And red, you're very isolated, and what can we do to help you? So something to think about there. I will share briefly what the 3-item loneliness questionnaire is. Again, this tends to be my favorite. It is the reason it is my favorite is because I'm a busy clinician, and I like to think about tools that can be a first window and pass into someone's life. And then from there, I can go into more depth. And really what you're asking folks is, do you feel laughed out? Do you feel isolated, and do you lack companionship? And depending on how you answer, the more often you feel this, the more likely you are to experience loneliness or to be experiencing it. So we've gotten down to how we define these things, how do we measure these, but who's actually at risk for this? Ultimately, and I will tell you my other bias is that I focus a lot more on loneliness than isolation, because I find that the complexity of loneliness in terms of our personal psychology and our personal life experience to be very fascinating and compelling. I also think that the sense of connection, that the really, not just the number of relationships, but how we feel those relationships is very innate to humanity and who we are. And so this is why I chose to think about this. But ultimately, the framework for how I think about who's at risk is very similar to how I think about other issues in medicine. So is there a genetic component that we should be worried about? I don't think we know this yet. Is there something in our biology? And I would say yes. And the biology meaning that we know, for example, that if we have hearing impairment or visual loss, some of that which is biologic, that puts you at risk for loneliness. We also know that things in our environment and in our lifestyle affect our impact us and whether we are lonely. For example, if you live in a rural area, where your ability to connect with others is limited and the quality of your relationship therefore suffers, that could be putting you at risk. Similarly, in San Francisco, though we are a busy and big city, if you are limited from connecting with others because of either stairs or now that people are using phones and computer because you don't have access to those put you at risk as well. In terms of age, so it's kind of interesting when you look at the research for age. We certainly know that there are increasing risks as we get older for being lonely. And part of that may be because of, I will say it, we live in a very ageist world and we don't value aging. And there's also this change in our identity that may happen as we get older. We may be changing jobs, retiring, moving, losing a spouse, losing a partner, gaining a partner. All these things can be risk factors. However, there is this part of aging that also brings some resilience. So as we start to learn more about what's happening with younger folks, there may be actually some things that the younger folks can learn from older folks in terms of how do you live through some difficult times and still have a sense of purpose and resilience? And how does that relate to our sense of belonging? As I mentioned, there's increasing concerns about what's happening with younger populations. And I think we're just at the tip of the iceberg of understanding why that is. I spend some time again talking about what is about losses that can contribute to loneliness and isolation. I guess, again, it's the other thing that's interesting is the idea of institutionalization and no longer being able to live independently. And this is tricky because for some people, actually moving in with others and being, I don't like the term institutionalization, but it's there. The group setting, for some people, that is fantastic to suddenly be around others. For other people, it's really actually worsening for someone's sense of belonging. Another topic that I wanted to just spend a tiny bit of time on is what happens at the end of life. And my colleague Ashwin Kotwal has been doing some really interesting work looking at senses of loneliness at the end of life and this idea of somewhat of existential loneliness. But we also know what's important to think about is that if in a national survey looking at older adults, 85% of older adults and their caregivers really prioritize social goals at the end of life, which includes sharing time with close friends, the presence of family, not dying alone, being able to help others, and not being a burden. Unfortunately, what we know about healthcare and end of life in this country is that often this is not what happens. And if you think about routine medical encounters, the social goals are not often prioritized and not often even talked about. So how do we think about supporting ourselves, our family members, our clients, our patients through these difficult transitions? So what do we know about the health effects? So ultimately, this is where it's really tricky. I started the talk talking about the differences between loneliness and isolation because it's important for us to understand that conceptually these are different, though they can be related. When you start delving into the research, the data is kind of all over the place in terms of what's causing what. However, the conclusions in brief are that loneliness and isolation are harmful at any age, likely worse for older adults because we have a smaller, more restricted ability to bounce back from insults to our bodies and our lives. And they're both bad, social isolation and loneliness. We can argue and get into the details of is it loneliness or is it isolation, but both of them to some degree affect our health. And you see it across, and I'll get into this a little bit, across the different organ systems, but literally we're at risk for greater heart disease, worsened control of our diabetes, poorer sleep and worse depression, frailty and functional decline. There's some emerging data about loneliness specifically and cognitive impairment, specifically Alzheimer's dementia, and then ultimately higher healthcare costs and increased mortality. What's fascinating to me is despite knowing these health risks, very little time is actually spent in medical encounters on these topics. A couple of years ago, the US Surgeon General, I was former Surgeon General, now Surgeon General again, which is exciting, really talked about some of the literature by my colleague Julianne Holt-Lundstadt, who indicated that social isolation here, not loneliness, but again, I'll put that caveat that I think it's all together, is as bad for your health as smoking every day. So that is important. This means that this is not insignificant. So how does this actually happen? So we think that the pathways into this is that there's a systemic inflammation. You can think about, again, if there is a distress of loneliness that is having a constant stressor on our body, which is increasing cortisol levels, stress hormones, causing increased inflammation and affecting all of our organ systems. This slide really is just an example of what chronic inflammation does to our body. So this is real. There are biologic explanations for all of this. It also makes it very complex in terms of how do we mitigate this, but it is no longer okay to just dismiss the scientific findings because they are there and they are valid. So fast forward to COVID. If we weren't isolated before and already experiencing increasing numbers of people who are lonely and isolated, suddenly, as I mentioned, we get forced into forced physical distancing and potentially isolation and loneliness for some of us. So to understand this, my colleagues and I at UCSF embarked on a local study looking at adults who were recruited from a couple different places around the city. And what we did naively at the start of the pandemic is we said, we're going to call you every 2 weeks to see how you're doing. Well, then 1 month turned into 2, 6 months later, and a year later, our participants are saying, I'm getting a little bit tired of talking about you because there's no end in sight. So we had to reconvene and think about how frequently we were talking to people. But the point of this is that what we were really trying to understand is what were people's lives prior to shelter in place, specifically in San Francisco, asking questions about psychological well-being, social connections, and medical needs. And what did we find? So we actually had a pretty diverse sample. This data is now a little bit older, but at the time we had 460 interviews that we conducted. The average age was 75. Predominantly white, but also a decent mix of other ethnicities, somewhat reflective of San Francisco, though not quite, but better than other samples. If you can see, 66 of our participants lived alone. Only 28 were partnered or married. And what you also see in our sample is a decent degree of trouble with finances and some functional impairments, as we discussed, with being hearing impaired, visually impaired, or needing some assistance every day. So what we found is that about 30% of our sample was experiencing frequent feelings of loneliness, and about 51% felt that their loneliness was worse. But some people actually did okay. So why is that the case? The other things, unfortunately, which may not be surprising for many of us, is that many people were also experiencing worsened depression, worsened anxiety, being worried about COVID, and also being worried and therefore delaying medical care. So I think we've all anecdotally heard about these things, and then we see them in practice. So in terms of the patterns of what we saw, so we in general saw 3 patterns of descriptions of loneliness during the pandemic. For some, loneliness was greatly increased. So what this woman said is, before the virus, I was socializing and seeing people a lot, but now I'm so much more lonely and isolated. And then on a follow-up interview, she says, I love technology, but it's been really hard to keep up with what's going on, and I'm feeling out of date. For the second person, she says, I'm not used to doing anything. I'm so used to not doing anything. This has been terrible. And then she says, this has been the hardest thing I've done in my entire life. And she notes, this has made my mental and physical health worse. So again, we're seeing it, the numbers, and we also see it and hear it firsthand by people. And then the third gentleman, who was living in assisted living, says, I have some loneliness. I've been isolated, we're confined, we're safe, but life is pretty dull. And I think that's what some people have experienced as well. Lastly, what I'll say about this study is that what we did find in terms of how people were connecting is that telephone communication was the most common thing that people were doing. And 79% of our sample had minimal to no video interactions. We'll find up on follow-up if 6 months, 12 months later, people were using more video follow-up. I think people are becoming more comfortable. But that's been an interesting thing to us, is that early on, as everything very quickly had to shift to video, was probably leaving a lot of people out. But what I've seen in my practice is that some people have been able to catch up and use more technology again to their benefit and ways to connect with others. How do we translate this all into practice? So I've shared some information on how we define social connections and disconnections. How do we measure this? What the effects are on our health? I gave some examples of what was actually going on in the pandemic. So now when we think about what's available to all of us to connect and have a sense of connection, how do we know if things are actually working? So when you look at the research, unfortunately, there's very little evidence, scientific evidence, of what interventions work. Part of that is because there's a lot of heterogeneity. There's a lot of differences in terms of what's working, what's available, and how these programs work. And I think what's challenging is that how someone becomes lonely is very personal and very individualistic. So that can be difficult to then make an intervention that is scale and is a one size fits all, which really, frankly, is the wrong approach. So how do programs like the Friendship Line, achieve something where you can scale and reach a large number of people at the same time, provide some individual connection? So when we think about, how programs work, it's again returning to these basic concepts. What is the issue? What are we trying to do? Who are we working with? How does the program work? How is their loneliness coming into play? And how do we actually implement the program? I will also say that when I think clinically, if I'm evaluating and screening my patients for loneliness, I have to think about why someone is lonely and focus my advice based on that. So for example, that may be looking at direct and indirect ways. So for some of my patients, they may be feeling more disconnected because I need to address their vision and their hearing, or for example, incontinence, which often keeps people not engaged with others. And then there's, of course, the direct interventions, which is social support, which Patrick will talk about with the Friendship Line, and how can you enhance the interactions people are having. There's one meta-analysis which looked at 20 randomized controlled trials. Unfortunately, what this tells you is that the effect of the interventions is actually really small. And the best evidence actually was on social cognitive training. What that means is helping people get through potentially those negative thoughts that you may get into when you're feeling lonely, and how do you get past that? So when I think about programs like the Friendship Line, this is kind of what goes through my mind as a researcher, but also as a clinician and as a community member. So is the Friendship Line targeting loneliness or isolation, or both? And so my hypothesis is that it is primarily working on loneliness, but it could be both, actually, quite frankly. We are primarily working with older adults, and Patrick's going to tell us a little bit more about who are the folks that are using the Friendship Line. And then we need to understand the mechanism. So what I mean by this is that older adults may be lonely for different reasons, and they may be calling the Friendship Line for different reasons. And because of that, Patrick's team really needs to work on training the volunteers to meet the needs of the callers, because they are all so diverse. But there's probably some themes and commonalities that they've gained over years of experience with this. And we also know that some of the people call in and say, hey, not only am I lonely, but I'm needing help connecting with other services. And I know that the Institute on Aging overall is a great connector for what's going on in our community. And then the fourth step is, what is the intervention theory? And what I mean by this is, how is the Friendship Line actually working? So what I think is that we're providing social support. I actually do think that there's a degree of social cognitive training going on. And of course, there's some social access. And so in some ways, you're getting, 3 for the price of 1 when you call the Friendship Line, or a couple different things, because it's not just one thing the Friendship Line is doing. So how do we figure out if the Friendship Line is working? Well, one of the things that we do is try to gather some information from people that they call in to try to figure out, who are these folks? What is their loneliness at baseline, and how do they do over time? So we get a sense of, is it working and whom is it working for? Just a couple more slides before I turn it over to my colleague, Patrick, to talk a little bit more and wow us with his information about just the history of the Friendship Line and what's working now. In February of last year, the National Academy of Sciences published a report on social isolation and loneliness and opportunities for the healthcare system. So this came out in February, just as the pandemic was starting. And there was concern that this was going to be overshadowed. And then suddenly we realized, oh my goodness, here we are in a pandemic, and suddenly all of these issues of loneliness and isolation are coming to the forefront. The conclusions of the report, and I was on the committee for this, were the following. We need a more robust evidence base for this area of work. And what that means, it's actually not a more robust evidence in terms of the risk factors and health effects, because that's there. It's actually more around, we need more evidence for interventions. We also need to then take what we're learning with our research and translate it into healthcare practices. That means that I need to encourage my clinicians and my healthcare systems to start to incorporate this into routine medical care, rather than saying, this is not important, I need not think about this. We need to improve awareness and strengthen ongoing education and training, and that is our role here, and why you're all here, hopefully to learn yourselves and take what you're learning and contribute to the conversation by sharing your experiences during this. And then ultimately also strengthening ties between healthcare systems and community-based networks and resources. And you know, as was mentioned at the beginning of the talk, my love is for bridging both the academic and community settings. And that's why I love what I do and I'm here. So what can we all do now? I actually think that asking and talking about loneliness and isolation is incredibly powerful. It helps to destigmatize what is going on. I have tried to be open about my own personal experiences with loneliness at this point in my life, although it's not the only time, and I'm sure, unfortunately, there will be other times, but it is a reminder for all of us to be open and vulnerable about our own experiences. I do think we can directly address social isolation and loneliness by connecting people to programs that can enhance social connections, and not just programs, but to people. So making the connections with your neighbors and others. And then it's not forgetting about indirect interventions. And there are a lot of things coming before Congress about how to pay for hearing aids, for example, for our older adults. So in summary, I gave birth during the pandemic. Here she is. This is my daughter, Gianna Maria, who is now 9 months old. Her full name is Gianna Maria Francisco Perissinotto. I think it's like 15 consonants and 16 vowels, as my husband likes to say, and there's a couple palindromes in there. She is making me more connected again. And I will say that I hope that we've, I've provided some information about how common loneliness and isolation are. I've provided some data showing that COVID may be making it worse for some, but not for everyone. We have to be creative about how to reach out to those who don't have someone to reach out to. And then I do believe awareness and advocacy is important, which is why I'm so grateful for the Friendship Line and so grateful for the Department on Aging for supporting Friendship Line and bringing some awareness to the issues. So make your voices heard, speak up for those who can't, and remember to be connected. And with that, I will turn it over to Patrick.
And Patrick, if you'll unmute yourself, we'll be able to hear you.
Thank you, Carla. Whoops. And thank you, Catlin. And also I want to thank the California Department on Aging as well for their invaluable support and belief in Friendship Line. And Carla, I'm sure that a lot of people are thinking about questions for you. So if I get booted off due to whatever weakness in my internet connection, I said earlier, I think Carla knows a thing or two about Friendship Line. So I think we will survive. And it's a real pleasure, as always, to work with Carla. Just because you ended with your 9-month-old daughter, as I said to Catlin and Carla before we began, is that my son and daughter-in-law also had a baby on July 14th of 2020, which was just 4 days, I think, before your daughter was born. I really appreciated what your comment was about your own experience of loneliness. And I just want to speak to that from a different generational point of view. As the grandfather of my son and daughter-in-law's baby, I also experienced a lot of loneliness. And too, because even though they just live 20 miles away from where I do, because of COVID, and just following the guidelines, I wasn't able to see her in person, and seeing the granddaughter only on FaceTime or Zoom is absolutely not the same as being able to. And so I had my own experience of loneliness, and I know many of the people who call Friendship Line are also struggling because of this pandemic, with not being able to attend baptisms, or not being able to, you know, um, see their grandchildren as they normally would have seen, if the family lived outside of the state of California. And so that's one of the things that I just wanted to support what you were saying, Carla. Loneliness and isolation are not terrains only of older people, and I think that's so important to keep in mind, that younger people also experience this, and certainly on the Friendship Line, we talk to both older people as well as younger disabled, and so Friendship Line, is very sensitive to the needs of both older callers as well as younger callers. Um, the other thing I wanted to mention too is that I'm so glad we're doing this particular talk today, because this is Older Americans Month. And I think it's just a very fitting time for us to talk about, isolation and loneliness. And one of the theme of this year's Older American Month has to do with connection and community, and I just think that's really what you're talking about, Carla, too, through this is, the importance of connections, for not just older people, but for people in general, and I really appreciate that. And the other part of this Older Americans Month has to do with engaging, people, engaging older people, and just how challenging that has been, for us during this pandemic. And I was also struck by the data that you were talking about in terms of the research you're doing with older people during, and just happened to be during this pandemic, that how interesting it is that people can be so resilient. I think that's the other part of this that I really, appreciate, because I find that as well, is that a lot of older people are very resilient, even during this very difficult period of time. And I think that's important for us all to remember. And also that lots of older people, if they have access to technology, like to do this Zoom thing, which always makes me a total wreck, by the way. And that's why I'm glad Catlin and Carla are here. So if anything happens, I'll feel supportive. Supported, not supportive. And
You can be both. You can be both.
Thank you, Carla. And so I think it's been a struggle, and yet I think the phone still is such an important, you know, uh, part of our culture in terms of connecting, especially for people in more rural parts of California, or rural parts of the country. So I really, and I spend, most of my time on the phone with older people and older grievers, and although I do my fair share of Zoom, but I notice that the people that want to do Zoom tend to be younger people, uh, where my older clients, even if they could do Zoom, and many of them could, but they say that just makes them feel kind of exhausted, that there's something about this. And that's one of the reasons that I've decided not to use my slides for this, because I think I know I get a little weary trying to read slides and hear people. And So I'm just going to talk through some of this, but also Carla, anytime you want to jump in, I mean, I'm saying this for the participants because I know you know to do that. And I really like dialogues more than I like monologues. So I did want to give a little background about Friendship Line. And some of you may know this, and I want to also acknowledge our volunteers, whether you're volunteers on the Friendship Line or volunteers in our grief services program. I'm very delighted and very thankful for your contributions because we certainly really need you more so now than probably ever before. And so I really am in a great deal of gratitude for all of your hard work. And back in the early 1970s, and friendship began before Carla was even born. So kind of way back there. And but some of you remember the San Francisco Commission on the Aging, and Joe Ruffin was the geriatric director of the San Francisco Commission on the Aging way back then. And they were concerned about the high rates of suicide, of older people in the city and county of San Francisco. And they were also aware of surrounding counties that when they would inquire about data from traditional suicide prevention centers, what they found was that older people, particularly older people, say 70 and older, were very underrepresented in their demographics in terms of age of callers to traditional suicide prevention centers. And so what they were curious about was, is the, a suicide hotline, are they reaching out to older people? Are they reaching that target population? And since I worked for a traditional suicide prevention center at the time, I was aware that no, we had, younger callers. And as Joe Ruffin had said to me, she said, if you're going to start a different program, make sure that you get, you recruit volunteers who really want to work with older people. Because when you look at the age of people that work generally at traditional suicide prevention centers, they tended to skew younger. And she said that's just going to be a challenge because they may not feel comfortable engaging in conversations with older adults. And so I kept that in mind. And we decided to think about how to approach this population of older people. And we talked about our grandparents and, how we engage them. And any of you that have visited grandparents at any time, holidays and things like that, and I know not necessarily during COVID, but generally what older grandparents would want to do is they want to give you tea or coffee, they want to give you cookies, they want to engage you in conversation. And if you decided you were going to see your grandparents because you wanted to talk to them about the need for them to, start to think about, making changes in their lives or thinking about end of life care issues, if you started that talk, they would see it oftentimes as a confrontation. They didn't want to have those kinds of talks. So what Friendship Line began with, and that's how we came to the name, is that I wanted to have a name so that when we answered our phones would say, hello, Friendship Line, as an invitation, as an invitation to a conversation, not a confrontation by saying, hello, suicide prevention. Because even if the person was, thinking about death or thinking, feeling hopeless or, isolated, that we didn't want to start with that because we were afraid that would be too much exposition. And so we would start with having a conversation first and appreciating them for calling the Friendship Line. So that's how we began.
And Patrick, I want to ask you,
time.
Sorry to interrupt. I wanted to ask
No,
you,
no.
I mean, it sounds like, when you got started, this was really a novel idea, because really before it had all been crisis oriented. Did people think you were crazy? Did they think it was a good idea? Did they think both? What was
Well,
the thought?
yes,
And different from
they
people who used it versus people that were funding. But
see yeah, this is very true, Carla, which they thought I was crazy. Uh, and I think people still do think that, and sometimes I do myself. Uh, but the interesting thing about that was that, you know, our formal name is the Center for Elderly Suicide Prevention and Grief Related Services,
mhm,
and you know, so we have those two components which I felt blended very well together,
right.
and I think it was Joe Ruffin who said to me, she said, you know, Patrick, you have, you know, three terms in your formal title that people funders are not going to like. One is suicide, they're not going to like that. One is older, they are definitely not going to like that. And one of them is grief. And she said, could you think of three terms that are so unsexy and uninviting to funders? Like she's, you know, it was really, you know, quite, I was quite aware of that, and realized that older adults, you know, certainly back then, were just not regarded at all, you
Mhm,
know, and people would say to me, "Why would you ever want to have a, you know, a nonprofit that talks about suicide prevention among the elderly? You know,
mhm,
why have that? They're old, let them go." And I still hear that to this day.
we
This is
still hear that.
2021, you
Yeah.
know, and you know, so I just kind of persevered and decided, no, this is what I want to do. And the reason that I really got into this back in the early 70s was that I found a gentleman who was in his early 60s, and he had died by suicide. I knew my family knew them. You know,
Mhm,
I didn't know them well. And he had a younger brother who was about 10 years or 15 years older than I was when I first moved to San Francisco. And I had come over to their apartment one day, one afternoon, maybe after work, and I just had got there, and I got there about 2 minutes before the other brother got there, and he walked into the kitchen to get something, and he came out and just left. And so I walked into the kitchen to see what was going on, and his older brother, who was in his early 60s, was on the floor, covered with blood, and he had died by suicide. And I think at the time I was about 22, and that's what got me into this, because I just thought, you know, and the guy was lonely, not
mhm,
isolated because he lived with somebody, not isolated because he did work, but he worked in an industry where the brother then told me that because he was in his early 60s and it was sales, that he felt he was too old and
mhm.
he was being discriminated against, and he really took that painfully hard.
I'm wondering with that story, and thank you for sharing that. And I think it's interesting, Patrick, how we all enter this work having, personal experience of some sort or some interest. And I think similar to you, I think I was noticing in my own, as a younger physician, that there was something going on with some of the people that I was seeing that was not really captured by the usual things we ask about. And I think that we tended to dichotomize things in simple things like it's just depression. And what I was noticing that there were times where I didn't think that it was just depression, or it was depression when I started my work, um, you know, people thought I was crazy too and still do. And sometimes I do too. So I'm right there with you. But it was,
We make a good pair.
we do. Um, I was like, oh, you're just looking at depression. Like, this is not, and I'm still fighting those same battles today. And I have, if I reflect back on my early practice, I think that I was treating some people inappropriately and not correctly because I was treating them for depression, you know, looking at just medications and not recognizing this whole other thing that I don't think we had a label for, you know, or a term for, or a way to talk about it. Now I think there's still so much stigma, but I, for the first time in the last few years, have heard patients directly tell me I'm lonely. And I've had medical residents for the first time finally say, I think this is what's going on. And I'm like, hallelujah, not that this is going on, but that we're recognizing it. I think we're so far from where we need to be in terms of understanding and doing something, but I think at least that getting the dialogue going is a step in the right direction.
Well,
And Caitlin, you can answer questions whenever, ask questions whenever you want, I think, and jump in.
Well, fantastic, because we're getting
Absolutely.
some good ones. Great.
Good.
Patrick, somebody wants to know, first of all, how they might go about volunteering for Friendship Line and what the qualifications would be, but also how did you get your first volunteers for Friendship Line? Who were these people?
There was a group called the Jewish Older Women's Group, and they ran, and I think some of you probably remember on Fillmore Street, they had, you know, kind of a discount clothing store, and these older Jewish women ran it. Well, fortunately, I knew one of them, and when I was seeking older volunteers, because I really wanted to, you know, get the word out about Friendship Line, which, by the way, was not easy to break into in San Francisco City and County, to break into aging services with a new service. That was very complicated. And, but that's, you know, so I met with the older Jewish women, and they were, you know, younger than I am now. So when I use that word older, it wasn't quite accurate. But they were wonderful, and they were very interested in volunteering. And so that's how I began. And then through their connections, and the Junior League of San Francisco was very helpful in the beginning, and the Department of Human Services, you know, older adult and aging services were very helpful. So that's how we kind of launched. And I was often on the Friendship Line, you know, certainly because we didn't have a lot of volunteers in the beginning. But just to Carla's point earlier, what we saw, and I believe then my theory was that if we could reduce loneliness in older people, if we could reduce feelings of kind of abandonment in these older people, then we would have an opportunity. If there was depression there, we could reduce feelings of depression, so they didn't have to be so withdrawn, and also we could have an impact on suicidal ideation, which, you know, I believe that we have accomplished, and is very important to me. And then the other group that I wanted to acknowledge is that we're also accredited by the American Association of Suicidology. So in addition to really be active, compassionate listeners on the Friendship Line, and being able to, you know, understand the complexity of aging in an ageist society, and how to help people, you know, accommodate to losses over a lifetime, it was really understanding loneliness, which was a key component, you know, of our work. And for anybody wanting to volunteer, by the way, just let me throw that in. We really appreciate it. And when you talk about criteria for volunteering, there are two main ones. One is, do you have an open heart? And how do you feel about old people? And I guess three, how do you feel about your own aging? So those are the three things that I feel are very important to think about. Caitlin, we can get them the information about how to contact us at Friendship Line.
Fantastic, and I can help distribute that.
You know, I'm seeing a comment
go ahead.
here in the chat, which I think is interesting, that I want to
Yes.
share and kind of dovetails
Yes.
on what Patrick was just talking about. And it says, I'm not lonely, I don't feel isolated, but I don't have anyone to discuss my problems. And sometimes it's nice to get advice. Sometimes it's nice to find out other people have similar problems. And I feel anxiety when I have problems. And I think that, you know, this is a really interesting you know, topic or idea, is that sometimes it's, you know, it may not be, does loneliness capture it all, or is it a sense of belonging or companionship? And, you know, your comment reminds me of my mom, who has suffered greatly over the last 2.5 years after the death of my father. And, you know, often what she says is, you know, I just need to talk to someone to discuss these problems, because otherwise they build inside of me. And it's very hard to be sitting here with my own thoughts and not be able to share them with others. And so I hear that, and I'm curious, Patrick, your response to that as well.
I think that is something that I've heard since 1973 on the friendship line, is that I think so many of our callers are saying very similar or making comments very similar to your mother, whom I'm so glad I met, and also your dad. I'm so sorry he died. He was larger than life, as you know so well, but I'm so grateful I met them. But I really, my heart goes out to your mother, and, you know, so many older people like your mother who are sitting there by themselves oftentimes. You know, many of our friendship line callers and our grief clients live alone, and they don't feel they can easily talk to their friends about these issues. What oftentimes I hear from, you know, because I would say the majority of callers to friendship line tend to be women, tend to be older women, and I know that changes from, you know, month to month sometimes, but I think that that message, which is, I'm just sitting here with my thoughts, and it makes me really sad, because it's, you know, that anxiety, you know, as you're kind of wondering about, you know, of what's going to happen tomorrow, you know, and but they don't want to necessarily tell their friends. So I just really want to emphasize what you said about the difference between loneliness and social isolation. You know, most of our callers are lonely, you know, and that's what Friendship Line was built on, you know, was trying to reduce loneliness through connections. And I believe then, even more so now, that connections with others bind us to life. We have to have people to talk to, but that sometimes doesn't equate to talking to my, you know, daughter, or talking to my son, or talking to, you know, another family member, because they don't want to hear it, is what I often hear. They don't want to hear me because it sounds like I'm complaining. You know, when what I say to them is, I think you're wanting to tell the truth about something that's difficult to talk about. And I can hear that, and our volunteers and staff can hear that. You know, we are open to what you have to say.
Patrick and Carla, I have another question that's for both of you. It says, in the spirit of what Carla mentioned, as in no one size fits all, number one, what is your approach to finding and reaching out to traditionally marginalized and hard to reach populations, because of the break in trust that these folks have experienced, like LGBT, gender non-conforming, African American, Indigenous, and other people of color? And two, what interventions have worked for you to alleviate loneliness and isolation for these harder to reach or traditionally marginalized folks?
I'll start, if that's okay, Patrick. So traditionally, to reach and marginalized populations, I will tell you, in terms of the research and the evidence base, it's horrible. Like, we don't have great evidence, we don't know enough, and there's so much more to do. And I'm sorry to be so concise, but that's kind of the sad state of affairs. I think that does leave an opportunity and challenge for all of us to know how to do that. And I think that requires a couple things. One it means actually knowing that these communities and these folks exist and doing very specific outreach. It also means that when we hire or when we have volunteers, that we have volunteers from a diverse group of people, so that you have people who are like experienced. That being said, I think, I look at this in two ways, and I'm curious to hear Patrick's thought, is that there is this part, again, I'll say for my mother who lost my father and is also an immigrant in this country, I think for her, having someone who can relate to those experiences brings some credibility and some, not just credibility, but sense of belonging and sense of similarity. But there's also this part that, feelings of loneliness can be universal and can be agnostic to what your age, your gender, your situation is. And so there is a way to relate on those things as well. So I think it's an and approach, I would say, but still a lot to be done, quite frankly. I mean, it's in some ways, I also think about the parallel and that we're seeing this in medical training, that we need more clinicians that are like the communities that they serve. I think one of my favorite things about my job as I'm Mexican, Italian American, that I can serve people from my own community and from my own background, which is really neat along with everyone else.
Yeah, and I don't have much more to add to that, Carla, because I think you summarized that very well. I think, so many of us who work in nonprofits have and who utilize volunteers have trouble, finding interested people from the Black and Brown community or the Asian American Pacific Islander communities. So I think it is about kind of finding ways to show up, and meet people. I know when I was teaching at Notre Dame de Namur, the beauty of the program in which I taught was that most of our students were immigrants. Most of our students were, African American or, Asian American immigrants who have lived here for, quite a while. And they were very welcome there. And so many of them would then volunteer on the Friendship Line because I was there and I was talking about Friendship Line. And so, it's I just think it's really tough. And I know on Friendship Line, fortunately, we have people, of diverse backgrounds, but not nearly enough. One of the things I wanted to mention, though, about, race is through, this pandemic, we're doing our grief services online through the Zoom platform. And what is so interesting, for example, our Saturday morning drop-in grief groups that we did, 12 people come each Saturday morning. And we couldn't really hold more than that in the conference room that we met. But because of the Zoom, we do 4 drop-in grief groups on Zoom. And it's just this serendipitous thing, which is, for example, we have many more Asian American women who come on the Zoom because they feel more comfortable than coming to the office. And I'm just kind of fascinated by that. And each month we have about 100 people altogether that have come to those 4 different groups, one of which is dedicated to people that lost loved ones to suicide. And it's just been a very interesting thing. So I'm just kind of pondering that, and as we kind of reopen, I'm really thinking we're going to continue our Zoom meetings, our Zoom grief meetings, because I think there's something about that offers a level of safety that doesn't happen face to face. Do you know what I mean, Carla? From that?
Yeah, it's interesting. And I wonder, there's this, and maybe, I don't know when that is, because it's personal, but there's a little bit of, I don't know if it's distance and self-protection. I'm not sure. I'm trying to figure it out, because I think also with what you're starting with at the beginning, there is this part that an all-day Zoom thing can be exhausting. And why is it exhausting in a way that in person is not? And I'm not sure. I think frankly, we have yet to understand what all of this what all of this means. And kind of as an aside, and you were mentioning earlier about how seeing your grandkid over Zoom is not exactly the same as in person. Yet at the same time, I think with my mother living in Southern California, it's like, it's an amazing way to connect in an extra way that we wouldn't be able to. So she still comes up and we prefer to see her in person, but when we can't, you know, she has we have an extra way. And I think, you know, Gianna gets to see her grandmother, and I'm a little bit frightening. She's now starting to reach for her through the phone, but so.
You know, I have another question here for both of you.
Yeah.
Seniors without children, or actually seniors often have developed extensive friend and family networks,
Yep.
but other seniors are extremely isolated and they have a hard time making new friends. So how would you encourage seniors who don't have family or friends? Obviously, Friendship Line is one way, but what are some other thoughts you might have?
Well, I'll just mention that, you know, I think this pandemic has really, you know, interfered, you know, with the way in which we have gotten together. You know, we know that a lot of older people I know would meet at McDonald's or places like that in the morning for coffee, or they would be there with their friends, or they would walk with their friends, or, you know, go to, you know, senior centers, that sort of thing, which has really all changed so dramatically over this last year and whatever it is, 5 months or something. And my concern, and maybe Carla, you know this better than I do, my concern is that I think for a lot of older people that I talk to every day, they haven't, they're not feeling really kind of confident that they keep talking about the old way. And I keep saying to them, I don't think we're going to be in the old way anymore, but I don't know what the new way is going to look like.
Mhm.
And what they're afraid of, and this is what I hear from them so many times, is that what if I die before I can actually reconnect with my people face to face? And then this is where the anxiety comes up, you know, this is where the fear and worry comes up. So, you know, I don't have a good answer to that, Catlin. Carla.
Yeah, I would say, I think there's a couple things. So it depends on, to me, if the person actually is missing and wanting friends. It gets back to this, like, what is loneliness? What is connection? And because we have to be careful not to be making decisions and assumptions for other people. It's one thing to have Patrick come to me and say, hey, Carla, like, I actually want more connection. I want friends. That's one thing. It's different from me to look at Patrick and say, Patrick, you need more friends. Like, those are different things.
Yeah.
And so as family members, as neighbors, as community members, making sure, like, some people are completely fine with their solitude, right? So getting a sense of what that is. The second thing, I had an encounter with a patient the other day in clinic, and we actually talked about the health effects, which he wasn't aware of. And I hope that by talking about it, that gave him a little bit more drive to make an extra push to connect with the people. He did have people in his community that he could connect with, but, you know, and I try to give him, like, hey, this is important for your health. Like, I'm not telling you to go take your blood pressure medicine. Like, this is actually, I believe your social health is just as important. And I was like, you need to hang out with your buddies. And he got such a kick out of it. But I explained, like, this is important to your health. It's not just me saying that. And we talked about how to do it safely. So there is, like, does the person want the help? Do they want it? Do they have opportunities for connections? And how, and then if not, then I think it's how do you balance the individual drive and, you know, having someone self-motivated to do that versus helping and aiding to find connections. There's two different approaches. I do think, kind of, again, like, not again, but just what drives the person, what are they interested in? Because I think that'll guide you a little bit into which direction to go. But, you know, I don't have an exact, this is the right answer, because as I mentioned earlier, there's not a one size fits all, and you have to be, you know, individual. You know, I think if my mom would probably get mad if I recommended certain things. If I instead suggested she connect with others based on her role as a volunteer, she'd probably be more interested in that than her being the one receiving the services. So there's different ways to think about it.
Right. You know, piggybacking onto that, somebody wants to know if you, either of you, both of you, can speak further to the long-term effects of this double whammy of social isolation and pandemic, and
Yeah.
how we can support the fallout of these, because it seems like there's increasingly, as Patrick kind of pointed out, there may be ongoing fear about going out, as well as fear of another public health crisis.
Yeah, so so a couple things. I actually think that, I'm sorry to be the bearer of bad news, but I am scared of the long-term effects, because I think we don't know. We do not actually know how long you have to be lonely and isolated to see the negative health effects. So I think it's probably shorter than we realize, but I don't think we know. And I think we're not going to know this for generations. And I'm hoping that there's someone doing research on that as we speak. I will say that in terms of the fear of going out and what comes next, we need to take one day at a time and really trust some of the science, which has been hard to do this year. And I've had to do this. I'm about to get on a plane on Thursday with my 9-month-old. And I'm like, am I crazy? Once again, getting back to this question. Yes, the answer is yes. But really going back and being like, well, what do I know about what's going on? I'm vaccinated, my husband's vaccinated. What do I know about the safety? What can I do to protect myself? And I am living proof of balancing the social connections. And what I have decided for my family is that our social health is very important. And if I don't attend to that now and don't attend to it for my young daughter, we will see long-term effects. And so it's about weighing the risks and benefits, which is what I have to do every day in my life as a physician with my patients, is that where is that balance? And sometimes, it varies from person to person. I get a little bit upset with some of my patients' family members that continue to isolate their family members and parents, which is enraging to me, quite frankly. I'm getting all worked up about this because they're not giving people the choice and not actually reviewing some of the science.
Yeah, I just want to say too to that question with people, older people that live alone, they often don't have that opportunity to discuss this with a partner, like you have your husband. And that's what they'll say to me is that, what they appreciate hearing from me when I self-disclose I live alone, but I'm somebody who is introverted and I also enjoy my solitude. But after a year and a half of this, I have to say that's wearing thin a little bit. I really want to be around people, but I'm also anxious about it for the reasons you're pointing out. And I don't have somebody on the couch that I can turn to and say, I'm getting anxious about that. There's nobody there. I don't have a sounding board. So I think it is often important for us, just as you're saying, not to make assumptions that, oh, do this and you're going to feel fine. It's even like in the old days, pre-COVID, would say to an older person who, may be lonely, have you thought about volunteering? But volunteering today is different than it was pre-COVID.
Yeah.
I have one woman, she's 69 years old, lovely person, lives alone. She wants to volunteer, but her options are volunteering, but staying at home on your phone or on Zoom. And she said, I don't want that. I'm lonely here.
Mm-hmm.
I want to see people face to face, but we're not there yet. So I think there is a lot of unknowns. And I think for people in their 80 to 90 corridor, that's tough
Yeah.
because, it's like I'm 73. I don't have 40 more years to live. How long can we wait? And I think that's troubling, but I agree with you when you're, being very cautious about what's going to happen in the future. I think that's realistic. I don't think we have a crystal ball.
Well, and I guess it's staying in the now. I mean, I had some patients early in the pandemic who wouldn't see me, that would say, I'll see you when this is over. And I'm like, I don't know when this is over. And I had some bad outcomes with some patients who wouldn't see me. And I think, so when is it now? So I think with the person you're talking about, well, I know you want to see people in person, but short of that, where's the middle ground until we can get somewhere else? Like, let's understand, what our actual risks are, and can we find, not the ideal and perfect, but it's okay right now and it's better than nothing potentially. So
Correct.
One issue that's come up is kind of interesting. We know that many people of all ages have, Americans tend to be identified by their occupations. And so many people have lost their jobs or have been forced to retire before they meant to.
Yep.
And they can feel lost and isolated when they retire or have to leave their work without choice. How do you support older clients or loved ones when they feel this vacuum after their youth work life has ended or suddenly ended?
Well, one quick thing about that in terms of people that are, contemplating retirement or have retired in the, recent past or longer, is that retirement for older people is a major grief experience, and yet what we know with most older people who are retired or have, in the process of retiring, it's all about finances, it's all about money or that sort of thing for a lot of people. And so they look at the financial aspects of it, but not the social aspects. And I think that's the thing, Carla, that I hear you really, saying to us. And I agree that once you leave work, and you know how people are, it's like, oh, we'll get together, and certainly in this pandemic, it's been very hard to do that. But when I see people in the old days, like leaving offices downtown on a Friday, and they have the flowers, the obligatory flowers, and they're carrying a little box, which is the leftover cake from their little retirement thing. And, people are saying to them, oh, we'll get together, we'll get together. But the stark reality is oftentimes that does not happen. And so the retiree, if they live alone, they might, and if they don't like gardening or other hobbies, they might just be lonely. And I think, we really at Friendship Line, I think what we try to say to people is you matter, you matter, you matter. And I think that's one of the themes that we say. And the other thing is tell me more. Tell me more about what that feels like to be retired, and I just think it's a complicated situation.
it is complicated, and I think, Patrick, I think about it, there's so much that people are going through in these times, and I think self-defining, and I've certainly had a lot of soul searching during this time, sleepless nights up, but it's, I think there's a couple of themes for me, and it gets also to the interventions, is how do we define ourselves? How do we view ourselves? What is our resilience and what is our purpose? And how do we value aging? If you are someone who has a negative view of aging, that once you're retired, there's nothing left for you. And if our society doesn't value you when you're retired, like those are tough things. And so I think about this as like having to get up on my pedestal and keep fighting against ageism. One, that's like the public sphere, but in the personal sphere, how do we think about, if I define myself only as a physician, what will become of me when I retire if that's the only way I see myself? And so I have to actively think about, my life and what's valuable to me. And I need to actively keep working to protect my generation when my generation retires, so that we are still considered valuable. So it's a lot of work. It's a lot of internal work. And having someone else to bounce back those ideas with, someone like the Friendship Line volunteers, if we don't have anyone else to talk to. Yeah.
I just saw an interesting statement come in. Carla, read that one.
My mom is 90 and saying her friends and family don't call her, yet she will not initiate a call. When they do call, she may or may not be interested in talking. What can I do? Ooh, this is a tough one. And I wonder, because I've seen this in my mom and in other people, like the fear of rejection or the fear of not being important. If I initiate a call and the person doesn't want to call, that will make me feel worse. I'm not like, oh, this is a hard one. I'm curious your thoughts, Patrick, also in terms of when they do call, she may not be interested in talking. I think that that's, so I have a couple of thoughts about this, and I'm curious, Patrick, your thoughts too. Given her age range, is she better with a scheduled phone call rather than a random phone call so she can prepare for that? Are there things that she is interested in talking about so that there are topics of conversation that could come up? It's interesting. My mom is dealing with this with her brother. When she calls him, he's not interested in talking, but maybe actually just those short phone calls are enough to just say, hey, you matter, and I remembered you, and it doesn't have to be this long conversation.
Well, I think you're right. And what I would also kind of add to that about when you said about scheduled times,
Mhm.
because I think it's very hard for a lot of older people whose value has been autonomy and independence, that they were raised, certainly, in my 70 to 80 corridor and people older, that, to be vulnerable with your friends and to pick up the phone knowing, we're friendship line is going to call at 1 o'clock.
I think we lost you for a second, Patrick.
And, that all they have to do is pick up the phone. And that I think is a little bit easier, I really like this scheduled calls. And I do that all the time, since
Mhm.
the pandemic began and I'm working from home. I call people on a schedule. They
Mhm.
know it's me, they know the time, and they feel much more relaxed. But when I suggest to them, well, I know you do see, they're not isolated, Carla.
Mhm.
They're lonely,
Right,
but
right,
they will not make that call,
right, right,
and I say, well, what's the difference? Well, because I can tell you, Patrick, anything.
right, right, right.
And I know you're going to call on Tuesday at noon. You
Mhm.
know what I mean?
Mhm. Mhm.
I think that somehow asking for help
Mhm.
still
Mhm.
continues to be a problem in 2021 as it was when I started Friendship Line in 1973. I
Yeah,
could see that a lot of people who could call in to the Friendship Line don't like to do that.
right,
But if we called out to them,
right,
outreach, that was received in a better way.
right, right. And I think that, to follow up on that, I have a colleague that works with the program in LA, and, she doesn't, some of the clients that she works with say, no, it's not the volunteer that calls me. It's my friend Patrick that calls me. So it's a different
Right.
also, which is amazing, right? So it's also like they formed a meaningful connection, which is really valuable. And not just, I don't need a service. Like I have a friend, you just helped me make that connection. I see another comment in the chat, and I'll summarize it, which says, that this person works in public housing for seniors and people with disabilities, and everything has been canceled for 15 months. How do we even start to have events outside, given that vaccinations are not mandatory and not everyone's vaccinated? So, I've been doing some work with assisted livings around the country, and I've suggested the following: is that you have to do it in incremental fashion. In the same way that you schedule phone calls, you start scheduling events and having people sign up so that it's not a mad rush and 100 people all at once, but really you start with 10 people. You start with a number of people where you feel like people can still have somewhat of a distance and feel comfortable. The other thing I will add to that, and I do think we're starting to be safe, we have to think about, if this is in San Francisco, remember our vaccination rates in the city are really high. And so our disease rates are low. And so our risk of disease is actually pretty low, but we still have to be careful. I think that you would be on the hook if suddenly you had this massive party. That would probably not be the right thing. But I will also say this wedding that I'm going to, what they've done is that they've polled people similarly to say, are you vaccinated and what's your comfort level? And we will all be wearing bracelets to kind of show, hey, I'm okay if Catlin gets close to me and talks to me, versus like, you know what, I want to be here, but I don't want people to get near me. So give people a sense of what this means. So I think there's some creative ways to think about that. Yeah.
And there's a last statement there from Sarah Lynn. She says, most of the seniors I know prefer certain individuals.
Mhm.
They don't realize sometimes that one person can't meet all their requirements. Do you want to speak to that, both of you?
Whew. Other than that was the marriage advice I got from my mother, who said, don't expect your partner to satisfy all your goals and needs. You have to diversify and have some people that other people in your life that help with different things. So thank you, Mom.
Well, I want to thank both Patrick and Carla today. We could go on. I think everybody's pretty engaged, but we only have this 90-minute block. So I want to thank again on behalf of IOA and the CDA, Patrick Arbor, Carla Perissinotto, and all of you attendees as well for being here. I want to say, if you're looking for continuing education, I will be reaching out to you and you'll get your evaluations and certificates within 12 working days. Thank you again so much, both of you, all of you, and we hope to revisit something, maybe a part 2 of this in the future.
Thank you so much,
Thank you,
everyone,
Carla.
for being
Thank you,
engaged.
Catlin.
Thanks, Patrick.
Thank you.
It's nice to have friends out there.
And Carla, if you will hit
Yes, it
the,
is. Yes, it
even
is.
if we're far apart geographically.
Exactly.
And Carla, if you will push the stop record, that would be,
Stop recording. Yes.
thank you.